Hello there, my name is Kamran Bhopal and I'm yet here again with another video for the Urology ST3 interviews. This is a history taking station for a small renal mass. This is quite a common station and also very important in urology, so you should be able to take some history of a renal mass as an ST3. This will include my format or my way of taking a history for a small renal mass, and you can adjust it according to the way you want to speak it, but the important thing is to include all points within the history. The way I would present this history would be, I would see this patient urgently in clinic as appropriate. I will check the referral letter and previous investigations and imaging that may be present on the system. I would also check the patient's identity and their understanding about why they have been referred. The differentials of small renal mass include benign and malignant disease, ranging from simple to complex cysts, to oncocytomas and AMLs, to renal cell cancer and TCC, the renal pelvis. And my history will focus on signs and symptoms of this, as well as risk stratifying renal cancer. In history, I would ask symptoms of the mass, which includes classic triad present in 10% of the people, including palpable loin mass, loin pain, and hematuria. Symptoms of metastatic disease, which is weight loss, anorexia, night sweats, bone pain, lower limb swelling, and symptoms of any paraneoplastic syndromes, which include increased PTH, and which is painful bones, renal stones, abdominal groans, and psychic moans. Number 2, increased prolactin, such as gynecomastia, Cushingoid symptoms, and also increased erythropoietin, such as cutaneous flushing. I would then move on to risk stratifying renal cancer, looking at history of smoking, obesity, hypertension, dialysis, occupational exposure to asbestos and cadmium, genetic factors such as von Hippel-Lindau disease, Birt-Hogg-Duke syndrome, tuberous sclerosis, and inherited papillary renal cell cancer. I would then ask for past medical history, including chronic kidney disease, single kidney, or any other factors which put the other kidney at risk, such as diabetes mellitus, hypertension, stones, pyelonephritis, etc. I would ask for past surgical history of nephrectomy or urological surgery, and medications such as anticoagulants and any allergies. I would also take a social history, asking about alcohol intake, checking for the performance status and fitness for surgery, and close my history asking about the ideas, concerns, and expectations of the patient. This is how I've always presented my history in a renal mass. This covers most of the important things, ruling out everything in relation to metastatic disease, and also risk stratifying, and for brownie points, paraneoplastic syndromes. So the rest of the format will be more or less the same that you know from medical school. I hope you all get a national training number, and all the best. See you next time.